everyone, welcome to our show. I am Khalalelo, and today we are sitting here with Dr. Richard Rasisemola, and we are starting on a topic about HIV/AIDS. As you may know, South Africa has some of the highest numbers and records some of the highest numbers in the world about people living with HIV/AIDS. So perhaps there is no better topic to start with when it comes to our health than HIV/AIDS. And I believe there is no better man, no better professional, health professional, to unpack this topic with me today. As you know, it's a topic that affects everyone, whether you are HIV positive, negative, whether you know your status or not. We see how in popular culture, in social media, how misinformation, even from our highest government officials in the past couple of years, even up to presidents, ministers who may be misinformed, leads to misinformation with the rest of the nation. So this is the show for you to be able to get that information, to be informed in a way that makes sense, in a way that's simple, in a way that's relevant for you or someone that you may know. So let's dive into the topic today of HIV/AIDS. I'm particularly excited. As I said, I know this will be information that is relevant to everyone. It is not exclusive of whether you are HIV positive or negative. So I hope people will take the pearls of wisdom, the nuggets that we give them today, in a way that's digestible and user-friendly for them.
Indeed.
Perhaps let's start off a little bit with why you're so passionate about this particular topic today and why you thought it was important for us to talk about it.
HIV is rife in Southern Africa. It kills people. It targets, the young, the old, the rich, the poor. And it's a preventable disease. It's a manageable disease. There are a lot of myths that exist about the disease out there, and that is what it is a driving force behind why we are not able to control it. So I think with this show we will be able to empower people and help them manage and be informed on how to prevent this disease, and those that are already living with it, how to live with it, in a healthy manner. Basically that's it. Yeah.
So basically, knowledge is power.
Knowledge is empowerment, yes. When you are empowered, you're able to make good decisions that are beneficial to your health, that are beneficial to your family, and ultimately that is going to spiral to be a healthy community. So yes, I believe in empowerment through knowledge.
I agree. So perhaps then let's start off with explaining to the layman what is HIV.
HIV, put simply, is disease. Is a blood-borne disease. Blood-borne disease means it is transmittable through blood. But later on, I will talk about other ways of transmitting HIV. But blood is not the only way through which HIV can be transmitted. But blood can contain the highest number of viral copies, or the highest amount of virus, and it's one of the risk factors in terms of transmitting HIV. So let's maybe start with breaking down what HIV stands for. HIV stands for human immunodeficiency virus. So it is a virus, and like I said, it can be transmitted through blood, and once it enters your body, it actually becomes part of your cells, and once in your cells, it uses your own body to multiply, to strengthen, and then be released out there, and then continue to replicate and multiply. Once you have HIV, because the middle word, immune deficiency, it attacks your natural soldiers or natural immune system, and it renders it ineffective against other diseases. So once you have HIV, you become vulnerable to many other diseases. And I think perhaps later at some other stage we'll talk about how does that then relate to another syndrome called AIDS. Yeah, but basically in a nutshell, that's what HIV is.
So then perhaps let's immediately then go into how are the known ways that we can contract, or do people contract HIV?
Yes, I think yes, it is a very important question because there are a lot of myths around, how HIV is transmitted. The most common way is through unprotected sex. You understand? So sexual interaction with somebody who has HIV and you're not using protection, you are at a higher risk of getting HIV. Number two, if you get in contact with somebody who is HIV positive, while you have cuts, whether in your hands or anywhere else in the body, and you get in contact with the blood of a person who is infected with HIV, then you are more likely to get that HIV. Other methods include through birth. You know, there are kids that are born they're not born with HIV, but they contract HIV through the birthing process, and that still falls under bloodborne because it is during that delivery, that vaginal delivery in most cases, that the mother's blood that is infected with HIV crosses over to the newborn, and that's how they normally get HIV. And the reason why I'm mentioning these two as the most common ones is because, you know, the sexual fluids, your semen, your vaginal fluids, as well as blood, those are the two bodily fluids that contain the highest number of viral copies, or the highest concentration of HIV in somebody who is infected with the virus. Yes, so unprotected sex, you can get HIV, and through birth, young kids can get HIV, and yeah, when you get into contact with somebody, with blood of somebody who is infected with HIV without protecting yourself. Other methods that are not so popular, but they do occur, and they relate to, you know, the two methods that I've spoken to you about. With healthcare workers, they do get HIV from needle pricks. Especially after pricking somebody who's HIV positive, they can prick themselves and get HIV from that. Those people that work in theater during surgery, you know, bodily fluids can splash and get into their eyes, they can get HIV from that as well. So those are some of the most common methods or common ways in which people can get HIV.
I think I have a newfound respect for health workers. Just thinking about how people like you sort of in your normal day-to-day line of work,
yes,
put yourself at risk, doing what you sort of put an oath and agree to an oath to do. So I just want to shout out to all the health workers out there, just being reminded in this moment of the very important work that they do to save our lives while putting risk to theirs. Thank you for that. So I know that even for myself growing up, or anywhere where you would see any communication around HIV, oftentimes it's written as HIV/AIDS.
yes.
So obviously there is a connection in that way to the two. And I know just from my own circles and speaking specifically in vernac, you'll find people use those terms interchangeably. So you'll find wherever there's any suspicion of somebody being ill or that sort of a thing, somebody who may not be informed will say, in a passing comment, I get AIDS, or it might be AIDS, because they use those two terms interchangeably. So I think perhaps there's a time then to be able to tell us, how is HIV and AIDS linked? Does one lead to another? How are they connected professionally, so that we know and not be misinformed to use the wrong term at the wrong time?
Yes, and I think that is important. When somebody tests positive, often you would hear other people say, he's got AIDS, or she's got AIDS. It's not necessarily the case. The relationship between HIV and AIDS is that, maybe let's go back to the what HIV stands for. You remember immunodeficiency, and I said to you that once you get HIV, then you become vulnerable to other diseases, because the virus itself attacks your immune system. Your immune system are just your natural soldiers that are normally protecting you from the disease that you meet on a daily basis. I mean, I could be having TB and I breathe out in the air, you breathe the very same TB, and if your immune system is not strong enough, then you will get my TB. All right. So there are many diseases that we are exposed to on a daily basis, when we go to work, when we're with our families, when we chill with our friends, right? So HIV, when it gets into your body, it weakens your immune system. When it weakens your immune system, then it makes you vulnerable to many other diseases. Now, the problem that we are having is that if you don't take treatment, if you don't take care of yourself, that HIV will then continue to invite more diseases to a point where the viral load becomes higher, your immune system becomes lower, and your body becomes overwhelmed. You get all these other, you get many other diseases, and then that's when we say somebody has got AIDS. So it is acquired immunodeficiency syndrome. So syndrome is a group of diseases. So this group of diseases are brought by your weakened immune system as a result of HIV infection.
Right.
So you get HIV, and then it progresses to AIDS at a later stage because you contracted many other infections when your immune system was weakened by HIV.
Right. I think that clarifies it a lot.
Yeah.
Hopefully, our viewers and listeners will be a little bit more careful to not jump to the assumption that something is AIDS when it's not, especially in the case of somebody else's healthcare.
True.
So I think then the natural next question is, how often should we be testing for HIV? And I think a secondary question to that is, when one does go and test, why is it necessary to then come back 6 weeks later? Is oftentimes how somebody who tests you advises you to do. I think it's 6 weeks, but why that short space of a secondary test afterwards? But in general, how often should one be testing?
There are government guidelines as to how often should a couple in a healthy relationship should test for HIV. Even if you are not in a healthy relationship, maybe you are in multiple partnered relationship, and even ordinary people that are single, you and I mean, I can say I'm single, but I might be having my door and piece job on the side, you understand?
Yes.
So it is advisable for people to test every 6 months.
Right.
The reason for that is that if you, during any of your Matoho and Mujolo time, contract HIV, we are able to pick it up early and start treatment before it weakens your immune system.
Right.
Or you develop other health complications. So if you tell yourself that you must test twice a year, so you know that it will be picked up early, and each time that you think you may have been exposed to HIV, regardless of whether it's every week, go and test. You need to test so that we know that you didn't have HIV prior to that experience, or if you think you have HIV, then you can start with treatment. And when I say you might have been exposed, if you are in a relationship and you normally use protection, and for some reason that protection condom fails, you need to go and test and get necessary treatment. If you were involved in sexual violence, you need to test. And if you were exposed through other means, maybe drug use, injectables, and you're exposed to other person's blood, you need to go and test. So each time that you think you've been exposed, and at least every 6 months. And even for those that think they are not at risk, is because once you pick it up, it will be easy to treat it before it's too late, you understand, before you develop all these other complications that are related to HIV. And the reason why it is important for you to test and test again in 6 weeks, HIV is like I said, it becomes part of you. So it goes through many steps. So, those steps, they've got very complicated scientific names, but in a nutshell, once you get HIV, it circulates in your body, it attaches itself to the cells, your cells, and then it finds its way into your cells. And then once it finds its way into your cells, that's when the body starts responding by releasing what we call antibodies. So let me give you this example. When you're driving and you're going to work, and there's traffic, you don't know why there's traffic, and all of a sudden you see the lights in the distance. you see red lights, you will definitely know that there is an accident there before you start seeing the actual accident.
All right.
So with HIV, when it gets into your body, it also causes some kind of alarm. The body will release certain chemicals that are going to tell people, that are going to tell the healthcare workers that there is an unknown virus or unwanted virus in this body. And those alarms, the specific alarms, are very unique, that even when you do a finger prick test, they're so specific that, okay, I think you need to cut that one out. Okay, those alarms, we call them antibodies. When you do a finger prick test, those are the things that we are testing for. We look at the antibodies as a response of the presence of HIV in the body. So that process can take up to 6 weeks. So you can be exposed to HIV and you go and test, but because that process is still happening, where the antibodies are being released, the HIV is still making itself part of your body, then you might think you are negative because the healthcare worker might not be able to pick up those antibodies, meaning when you test, you're going to test negative, whereas there is actually a virus that is still busy multiplying and becoming part of you in the process. So when you come back 6 weeks later, that process would have been complete. If you are HIV positive, we will be able to pick it up. And if you're not positive, then you will still test negative. But that doesn't mean that you shouldn't continue living a healthy lifestyle, ne?
Of course,
yes.
Of course. The aim is always to live as healthy as we can.
Yes.
But I thank you for that information, because I think it's really, really important that it's not just an emphasis on whether you think you may have contact with this, that essentially everyone should be regularly testing.
True.
Is the message we're trying to get
and
out there.
It's free. It's free. I mean, testing for HIV is free, and it's available in many, many centers. You go into the clinic and you say, I want to test for HIV. You get free counseling. And I don't know why is it supposed to be something complicated. I mean, you shouldn't even make an appointment. You walk into the clinic, literally walk now and say, I need to test for HIV. You will find that the queue is not as long as the other queues in the clinic. So 15 minutes, you're done.
That's true. I've experienced that. Where you're in a healthcare facility, and those who sort of are of the same mind as you to have people test as often will often even approach you.
Yes.
As a nurse, as a doctor maybe, to say, when last did you test?
Yes.
And therefore, let me take you out of this queue that you're in, that you'll probably sit in for a while, and let me quickly test you, and it doesn't take so long. So again, that's the message to do that, because it's freely available to you as often as you need to do. So thank you for that. So we've talked about testing. Say I go and test and I come out and it is negative. How do I keep it that way? How do I ensure that I stay HIV negative?
Right, and without thinking that there's an obvious response to this, condom use. And we know condom is one of the most effective way of preventing HIV. And not just HIV, but all these other, sexual transmitted infections, including unwanted pregnancy. So, you hit 3 birds with one stone. But condom use. And condom use, I need to emphasize on the correct way of using condom. There are instructions on the package of the condom, right?
Yes.
And you might think people understand how to use condom. Maybe I should take you back to when I was still a clinician. We gave a woman a packet of condoms to give to the partner to show the partner that we need to start using these because you travel a lot. Basically, you are at risk,
right? And
I'm at risk,
right?
And we thought this woman understood exactly how these condoms should be used. The woman came back 3 days later and said, "But now it's full down there." And we asked, "What are you talking about?" This woman was taking these condoms every day, taking them out and pushing them inside her vagina, thinking that those condoms are going to protect her from unwanted pregnancy, from HIV. So I don't want to take chances thinking that everybody knows how to use a condom.
Yes.
So condom use, correct condom use, right? Condom, the condoms that are distributed freely by the government in the clinics and all these, community halls and all these public places, they've got instructions on how to use them. and they should be, properly lubricated. Because if it's not properly lubricated, it is more likely to break. And when you ask later, how did you get HIV? At that time, the person will tell you, but I've used condom, right? It's true, they've used condom, but it broke.
Yes.
It's because they were not using it properly. If you're HIV negative, yes, take your use condom, abstain, and be faithful to your partner. And I think these are the things that the government has always been trying to tell us. I think maybe the problem is the way the message gets to the people. It is not broken down in a way that people understand it. But yes, especially about the condom use. We distribute the condoms, but we forget to tell people how to use such condoms.
And perhaps it's worth mentioning as we speak about men and women, but I think it's worth mentioning that this information obviously is relevant to anybody engaging in any kind of sex, or homosexual, heterosexual relationships, and the likes, is something worth saying, that this information is relevant to any and everyone.
Yes.
Not just particularly those who identify as men and women. But I also wanted to, on that point, before we move on, because I know there's a very popular word that pops up on my social media when we're talking about this topic, is this thing called PrEP, that is gaining momentum amongst people, maybe not in the most correct way or in a way that we understand. And maybe not going too much into detail, but in talking about abstinence or in talking about protecting yourself, maybe chat a little bit about what PrEP is or who it's relevant for.
So the government has got guidelines on who qualifies for PrEP. Maybe let's just start with what PrEP is. It's pre-exposure prophylaxis. It differs with PEP because PEP is post-exposure, meaning you have been exposed to HIV or an incident that is likely to bring you HIV, and you get the treatment after. So PrEP is when you think you're going to be exposed to HIV, and then you can get the treatment.
Okay. So we've talked about you go and test, you are negative, you want to keep it that way.
Yeah.
Let's talk about the other side.
Yeah.
You find out that you are positive, you get the counseling immediately at the clinic. But after that, what are the treatment options that you would likely embark on from that moment going forward to keep you healthy?
Yeah. So the government has made strides in terms of providing treatment that is tolerable to people that are living with HIV, right? You used to get many drugs. People used to even call them breakfast because there used to be so many drugs. When you eat them, they fill your tummy.
Right.
So now the government has come up with the pharmaceutical companies, and they have come up with what we call fixed dose combination, FDC in short. So it's a combination of different drugs, and I don't think I should go into that because those names are very scientific. But I can tell you how they work. You remember I told you about different types of HIV. So those drugs, they target HIV at different levels. Some of them prevent HIV from entering the cells, from attaching itself on your normal human cells.
Right.
While others are preventing HIV from replicating within your cell and multiplying and making more and more copies. And other drugs prevent HIV from leaving your cell and going to affect you elsewhere. You understand?
Right.
So that's why they give many drugs. But pharmaceutical companies made strides in terms of developing a fixed dose that is, it comes with one pill, and it saves people from taking so many pills and so many times during the day. And the other way of making sure that you live healthy while you are HIV positive, it's the importance of nutrition, and it's going to take us back to the message of the late Dr. Manto Chavala Msimang. She was vilified when she spoke about beetroot and garlic and vegetables.
She was.
And the media made it look like she's saying that those vegetables are curing HIV, and that's not exactly what she was saying. She was just saying that those vegetables have got a higher amount of antioxidants. They are able to strengthen your immune system so that your body is able to fight against the virus. Remember, when it comes to this virus, it's a fight between the virus and your immune system. And one has to should the virus win and your immune system goes low, that's how we progress to AIDS.
Right.
And that's how the virus kills you. So the fight is to always keep the immune system up. The virus is normally going to be at bay. You understand? So through nutrition, there are vegetables, there are food that we know are high, they've got higher nutritional value, and they're able to make your immune system strong. And generally adopting healthy lifestyle. I mean, you need to exercise, you need to, live stress-free life, because stress is one of the, conditions that actually kills your immune system. And, continue living healthy lifestyle, because you can still be reinfected. Even when you are HIV positive.
Wow, I didn't know that.
Yes, you can still be reinfected. Continue using condom even if you are HIV positive. It's not to protect your partner, it's also be protected from other people that are HIV positive. So continue using condom, live a healthy lifestyle, exercise, eat healthy, lots and lots of vegetables, especially beetroot and garlic. The one that Dr. Mantu Chabalala Msimang was vilified for advising people to take.
So there was wisdom in there at least.
There is a lot of wisdom. It's just, when these kind of things become politicized, we end up missing what the actual message is and focus on the person instead of the content.
Right.
Yes, yeah. So exercise, live a healthy lifestyle, avoid stress. Stress kills your immune system. Take treatment.
Yes.
Because the goal is to keep your immune system, what we call CD4.
Right.
CD4 cells must be higher. When the CD4 cells are higher, then the viral load becomes low. That's why even when you go to the clinic, they check your CD4 cells, because it can tell them where the viral load is.
Right.
If the CD4 cells are higher, then it means the viral load is low.
Yes.
With some people, I know you've heard of undetectable.
Yes.
So that means the virus is at bay. It's so low that it is undetectable when you test this person. And during that time,
yes,
it is impossible for this person to pass the virus to the next person.
Interesting.
I know it can sound controversial, even if you don't use protection.
Interesting.
It's impossible for you to pass HIV to the next person if your viral load is suppressed. And that's how, in most cases, when you have a couple where one is HIV positive and one is HIV negative, when they plan to have children, without putting another partner at risk, they wait until the viral load is suppressed to engage in unprotected sex for the purpose of for the purpose of pregnancy. Yeah.
Right.
Yeah.
You actually answered my next question, which was going to be whether a person who's HIV positive and one who's HIV negative can still have a sexual relationship in that way.
Yes. Besides what I've just mentioned. Remember when we talk about they can still continue to have a normal, healthy sexual relationship with protection. Right. Yeah, because when you add a condom in the mix, many people frown upon it, and they think it reduces intimacy. So those are just perceptions. It is important so people can continue to have a healthy sexual relationship where one is HIV positive and one is HIV negative by using condom. And if they want to take their relationship to the next level where there are kids in the relationship without putting the other partner at risk of contracting HIV, then they must think of waiting until the partner that is HIV positive is virally suppressed, and so that they don't pass the virus to the next person or the person who is HIV negative in the relationship.
All right.
Yeah.
So thank you for that, and we've gone through sort of the facts of the matter around HIV and AIDS, but I think there's a point and there's sort of a rounding up of the conversation that we need to have perhaps about South Africa and our attitude towards HIV/AIDS. As spoken about in the intro, that we have some of the highest numbers in the world, not just on the continent, of people living and dying from HIV/AIDS. And so from someone like you who is in the field, who knows the health system and patients and that sort of expertise, what do you think is the reason that we boast some of the highest numbers? What do you think are South Africans' attitude towards HIV? And I will even push it to say, do you think we have a certain arrogance or fearlessness that sees us decades after decades continue to have such high numbers? What do you think our attitude is towards the virus and AIDS?
You see, there are a lot of conspiracies and myths around HIV, and why do we have HIV in the first place? Some will tell you that in the 1800s it jumped from chimpanzees to human beings, and we continue to spread it amongst each other through unprotected sex. Scientists back in the days, they used to think it's some kind of a cancer that is passed through sex. And then while others are thinking that it's something that was cooked in the lab and it was injected in people just so that they can produce a drug to treat it and make money, you understand? So I'm not going to entertain that. But the fact of the matter is some of those misconceptions and myths are the ones that are driving this HIV. And I will tell you, when I say driving, it's enormous. The scale is enormous. In 1982, when the first man was tested HIV positive in South Africa, he was coming from California. He was a homosexual someone, and later that year, they did a HIV test on 500 people, and about 12% of them were found to be HIV positive. At that time, it was not even famous. Now, years later, now this year, we've got more than 10% of the population living with HIV.
Right.
I'm talking about maybe about 11, 12 million people that are living with HIV. And I'm talking about those that have tested. There are those that have not tested, and they will say, my wife will come back, and if she's HIV negative, it means I'm HIV negative. You
right.
understand? So more than 10% of the population is living with HIV. And if I were to break down these stats again, the research has been done, particularly around the question that you're asking. Why are we getting so much in terms of, why are we getting high numbers in terms of HIV, people living with HIV in this part of the world? Majority of the people start having sex before they turn the age 15. With women or with ladies, they normally have sex with somebody who is more than 5 years older than them. And that's the blesser effect. That's where they do get HIV. At 15 years old, you agree to anything. You are new at this thing. You agree to anything. And that's how they get HIV. Because of that myth where when people got HIV, they believed that by sleeping with a virgin, they are cleansing themselves of the virus. So many people got HIV, so many women got HIV through that. Understand? And the issue of poverty, you know you're in a relationship, this person is gallivanting, they're going around sleeping with different people, but because this man is my bread and butter, you are begazela, you just live there and you get HIV.
All right.
And earlier when we were talking about alcoholism, South Africa is one of the countries with highest number of people living with alcoholism or consuming alcohol.
Right.
So when you are drunk, you tend to make careless decisions, and those decisions also translate to the way we behave in terms of sex. So people have unprotected sex, our attitude towards sex, and our attitude towards condom, even when we are drunk. So those are some of the factors, and not all of them, but those are some of the factors that are driving HIV, the numbers of people living with HIV in South Africa.
Right.
Yeah.
So then perhaps to close then the conversation right now, because I think efforts around changing our minds, changing the psychology, changing conversations around culture and who believes what and blesser effect and that sort of a thing, is perhaps a bigger conversation or a topic for another day. But I know what we at least can do with this episode then is target misinformation or ill information. So perhaps in closing, you can let our viewers and our audience know where we can find more information on HIV AIDS, official places where we can find correct information.
So information is available through the Department of Health website. On the search area, you can just type HIV, and there's a lot of information that is going to come out. And the nice thing about that is you can change the language and read the information in any language that you want. For those that don't have access to internet or don't have access to smartphones or laptops or computers, you can go to a local clinic. So you will have doctors, sisters, you will have physiotherapists there. They are normally readily available to assist you with educating you about HIV. There's a lot of information on billboards. There are posters around the clinic for those people that can read.
Right.
And there's so many NGOs as well. They go around providing health talks around HIV. So information, even if you are not looking for it, it will come to you. So there's a lot of information about HIV out there.
So in other words, ignorance is not an excuse for anyone.
Never.
I like that. Well, that concludes our discussion today. We could go on and on. There's so much more that I know even people who are watching may have questions. And there's always a time to do a part 2 and as many parts as we need to do. So I just want to thank you, Dr. Richard, for being with us today. Your knowledge is invaluable. You're such an easy person to talk to. So I know if anyone is to recognize you out there on the streets, and they're trying to talk to you and they're trying to ask information, they'll get as much of a warm reception as I did. So I just want to thank you for that and give you a shout out for just continuing the work that you do and the passion with which you do it. And I just want to thank everybody who's been listening, who's been watching. Your feedback is what drives us. Your feedback is wanted. Your feedback is needed. So be as free as you want to be able to let us know what you want to know, what other topics you want us to cover in terms of health, as this is not only just a passion project or something that we do in passing, but really intentional in being able to help you or somebody else that you may know who's in need of information. Of course, in future episodes, we'll be delving into other popular and not so popular diseases and viruses, and even just topics around mental health, health in general, that we will know to cover as long as you give us feedback. So please do reach out to us on our social medias. In any way that you can get in touch with us, we are more than welcome to hear you, and we will respond, and let this be a two-way conversation. So my name is Khalalelo. We are closing this episode. See you next time.